Hello and welcome. My name is Lee Peterson. I am the host of the podcast WDcast. And we call it WDcast because it is hosted by WD Partners, whose tagline is innovation at scale. And so they are experts in end-to-end services in terms of strategy and design, as well as implementation, architecture, and construction management. Again, end-to-end services. That's at wdpartners.com. Thank you very much, WD. Thank you, Chris, in particular, for sponsoring the show. Just a little reminder, the mission of the show is to discuss the burning platforms of our time. And we started this pre-COVID, just so you know, but it seems like the burning platforms of our time are sort of bifurcated into two areas. You are either burning forward with like rocket fuel, incredible speed, which is what's kind of happening with the guest that we're going to speak to today, or you're sort of spiraling down in flames, with that burning platform. Your burning platform is no longer with you. So it's super interesting times, and we've got somebody with us today that is someone who has been an expert in the healthcare industry for quite some time. He started a company called Health in Motion, the Health in Motion Network. And he is also involved with OCN Connected Care, OCNCC. His name is Brian Slusser. And Brian, thanks for being on today. We appreciate you having here. How are you doing?
Doing really good. I really appreciate inviting me here.
Great, awesome. So let's get to it. So Brian, I always find it curious, like why people do what they do. Like what got you into one thing. And I know in my case, I started doing one thing. I thought I was going to do one thing in college, and by the time I was 30, I was doing something totally different. But healthcare is one of those industries that if you're not a doctor, it's pretty curious how you did that. So could you give us a little background and tell us how you got involved and how you got to where you are?
No, absolutely. I appreciate the question. I'm going to give you the abbreviated answer. Other would be a one-question podcast here today. So I'm going to give you the abbreviation. So, as I started into, you can kind of sum up everything I've done in healthcare and really is providing from the 1980s, late 1980s until now is creating access to local healthcare, creating access in a way of organizing healthcare, providing scaled infrastructure for healthcare. And again, an example of that was a previous business that I owned that we built around community pharmacies. And again, at that point in time, healthcare was being limited access. There were closed networks. Things were preventing access to local community pharmacies. So we organized around that. And again, lots of little parts becoming big parts and organizing both the best parts of healthcare. So really what we've done is we've been focused on up to this point, what we're doing now is access to healthcare and doing it in such a way that kind of hits that triangle, access to quality and cost is what drives healthcare. And usually what you see in healthcare at this point is you have to give up one to achieve the other two. So if you're going to get access and you're going to get quality, you're going to give up something from a cost perspective. So with innovation, what drives us is you can solve that for everybody. You can solve the quality aspects by perpetuating and bringing the best providers forward.
So what'd you come out of college as?
Nothing like this. Nothing like this. As I started in industry, I was really intrigued with healthcare in general. And again, I was introduced to a company named McKesson. And I really got started there right out of college, working there. And again, that's where I cut my teeth in healthcare to start. I was working with that company. And again, I became their second largest retail customer in time as the company I built was doing $1 billion a year in purchases from McKesson.
Oh, wow.
We were behind another little company called Walmart in their repertoire.
Yeah, I've heard of them. So you're sort of a serial entrepreneur.
I think serial entrepreneur, I kind of will reject that a little bit, Lee, just in the sense that it basically would say the focus is all on me. The focus is all on my ingenuity. And I'm the crazy dancing guy. I'm the guy that has a vision for something. I'm motivated every day by if you have an opportunity to make a difference, you have the capabilities to make a difference. If you don't, you're wasting your time. Really, my shtick, if you want to call it that, is attracting the right people that we can align vision and get things done. my goal in life is to empower people and empower people around me, diverse groups of people that really are charged with something that can basically take on responsibilities and achieve goals they didn't know what they're capable of. So my whole thing is being a serial entrepreneur is getting things started, getting people that are bright around you. That's always what I've strived for and have achieved.
I can totally identify. I started design here at WD Partners in the same fashion, where the first thing I did was surround myself with 3 or 4 people that I know I could trust in a foxhole, and then kind of build from there. And the same could be said in just about any industry. I mean, you can't do it all yourself, so you have to surround yourself by people actually that are better than you. And I think that's how you wind up in a great position.
Mm-hmm.
And that happened to you, right?
It absolutely sure did.
Yeah. So talk about like your companies and what they specialize in. Like a lot of industries, like I read the name and I think I get it, but it'd be great to hear from you, like what you think each one of them like specializes in, and why do we need them?
Yeah, absolutely. And I think what we have been charged with is more organizing a large group of providers. We are committed to and understand that the best in healthcare already exists. It's just not accessible. So the big tipping point here is innovation in your local providers. Your doctor, your specialist, somebody that you're going in for surgery is now using a service that they've never used before. So how do we build on that? So how do we not stop there? How do we build on that? So our charge really is organizing those providers, getting them onto a common platform to provide healthcare. What COVID has taught us is lack of communication, patient engagement. We're pushing out 90-day supplies of medication without any care management or anybody talking to a pharmacist. That's bad healthcare. So we're seeing all these delays in healthcare at COVID. That my job is, and our role is to organize access, using innovation to put around independent community pharmacists, around primary care practices, around urgent care centers, to obviously create the on-demand model that they can be.
Oh, I get it, and so that goes across platforms, really.
Most definitely.
Okay, so maybe you could take us up to 50,000 feet a little bit in terms of healthcare, because it is like to the point where, when I watched some of the Democratic nominees discuss it, and everybody talked about their healthcare plan and how they were going to do healthcare and all that. So it became such a buzzword that you almost, how that goes, like you almost don't hear it.
Yes, exactly.
So talk to us about the kind of state of the healthcare world.
It's too complicated. There's no predictability to it, and we're missing the pain points in healthcare. Being able to address pain points, and most of that is not being addressed being personalized and offered in a fashion that as healthcare consumers now, they're not willing to go through the maze that existed before. Today the consumer is in charge, along with that, taking in consideration the provider aspects of that. That they have to be in a position to deliver care, deliver quality, and innovation supports that. So the obstacles in healthcare are so many. You can talk about regulatory. You can talk about so many things that stifle innovation. I think we're seeing right now process of getting drugs approved in this country is somewhat complicated, maybe archaic. So I think that those kind of things that have to be streamlined are really what's in front of the genuine parts of healthcare, which are providers, are your specialists, are your oncologists, are your pharmacists. That's healthcare. We just can't directly engage them. You're dealing with an insurance card. You're dealing with somebody that's guiding you to it. They're telling you to download healthcare with an app. So we're kind of that optimistic viewpoint. That's because we're business minded, not clinical minded.
Mm-hmm.
I don't have to fight government regulations on how I'm reimbursed. I can provide solutions so we can change some of that. I'm not underwater because of Medicare reimbursement as a practicing physician, or filling prescriptions as a pharmacist. So there's some of those things that we have to address that are big obstacles, because it isn't our right to have providers, practicing today and not making anything off of it, not having a healthy lifestyle that goes along with providing our healthcare. So there's a whole obstacle around balancing it. access, quality, and cost.
Yeah.
It's eliminating, in my mind, is eliminating a lot of the oblique, the things that are in front of healthcare, the middlemen, if you will, that are really driving cost in the healthcare system. So we're focused on access and direct engagement.
That's sort of a hallmark of capitalism, where once a good idea is out there, then you get like 500 fingers in the pie until somebody really does it right or has their heart maybe even in the right place. And you touched on this for a second, but access to healthcare seems to be the big one. And we've got apparently 30 to 40 million people without it, apparently. Like, how can they get access to it? Like, why is it so difficult? And then, like, how can people who don't have it, who have the wherewithal to get there, how can they get access to healthcare?
Very good question. Again, it is the $1 billion question, $1 trillion question, if you want to call it that. It's a situation where it's physical environments. So how do we redesign physical space? How do we deliver a primary care practice within a pharmacy that's in a rural town because there's no healthcare within 50 miles of that location? Things like that are taking physical space and bringing the best specialists that may exist in a metro market, 80 miles away, being able to bring the best healthcare in an environment that is uh, supports the physicians that are practicing on it and also provides quality healthcare at a remote level. And that's part of it. The other parts are pretty obvious in how we utilize telemedicine to engage healthcare, not using it to perform and deliver results, because that's a provider's responsibility. So it's coupled with redesigning healthcare, its physical space, its access, and then also adding the virtual elements to it to bring more healthcare to the consumer on their terms.
So a little bit of going to them
A lot of going to them.
a lot of going to them,
Yep.
more than them trying to find you. We have to go into the way that they live and the way that they understand things and to help them get access to it. It seems to me like clarity is kind of another factor. Like, hey, uh, I'm sure you're familiar with Harry's shaving.
Yes.
Yeah. And
Yeah.
so they got me hooked in the beginning because they said, we have this razor and then here's some razors for it. And it's like $9. Why don't you buy it? And I thought, yeah, why don't I buy it? Because I've been buying like $35 razors up until that time and it looked really cool. And so they created an easy access to an industry that was just a big mess and too expensive by just kind of cutting through with a couple of simple questions. Sort of similar, right?
It's similar, and I think everybody wants to take the simple path, and say, well, why can't it just be Amazon? I buy a product. I have my groceries delivered 3 days a week. Why can't I just get healthcare that way? It's a
Yeah.
little bit more complicated. So from that standpoint, everybody is accustomed to product, the speed of light. You're seeing pill pack. You're seeing things that are out there that are just, more consumer driven. Most of us that practice in pharmacy recognize that as old technology, honestly, old packaging, just in a consumer level. But what's missing is who can deliver the care that goes along with that product. I mentioned it earlier that 90 days of medication going out to a patient without a pharmacist in sight or available is a real problem. So we're using technology when it outpaces the ability for quality healthcare to be delivered through it, it's going to cause more problems. So I think that we're all saying consumer driven. Consumer part of it is you can't forget who's providing the care and the service that goes around it. It isn't just product. I think employers today, they want to be able to buy healthcare just like a product. And all they're saying is, I want you to also focus on, my large pain points, which are complex care issues, complex care management of employees. If you can help me do that and provide me a consumer friendly program, that manages complex care as a lifestyle enhancement, doesn't focus on a disease. So again, that's where our partnership with WD Partners is really strengthening our resolve, in the sense that we can know clinical, we can know innovation, we can know all the elements of infrastructure that go into IT and all that. But unless it is consumer, if it isn't healthcare, true healthcare in their hand, it won't survive.
Hmm. Interesting. I have to ask this, but Bernie Sanders is on a campaign, and so are a few other politicians, really talking about healthcare for all and Medicare for all, and largely And this is one of the reasons I'm sure that he didn't get the nomination. Largely, that's kind of unacceptable to consumers. And at the same time, I think, if you ask them, are you happy with your healthcare provider or where it's going? They'll say no. But it's like, you get the feeling that's not the answer. Is that true? Like, what do you think about that?
No, I think you're absolutely correct. I mean, I go with, not politics aside, putting, burning aside relative to that, but, those that are charging for Medicare for all. Again, I would have to say, the genuine problems in healthcare in the U.S. are largely because, it isn't a free market system. It isn't free enterprise. And I think that adding more government regulations is, number one, going to stifle innovation, is going to stifle how we go forward. Mentioned earlier, FDA hurdles and things like that. So, what do we want to do is kind of clear that way, is actually look at healthcare differently. I want to say this, that maybe moderate, instead of looking at this as a human right, let's start with humanizing healthcare. Start with personalizing and humanizing healthcare. Before we say it's our right to have doctors and pharmacists practice at a loss. So humanizing it is the whole experience. What I've been marveled with W Partners in revolutionizing our physical space is it humanizes it. It takes technology to the back seat. It puts humanizing, using innovation to humanize healthcare. And I think that is the strategy. That is the future, is bring those that are providing healthcare, your doctor, not a doctor front that you don't know, that doesn't have your patient information. So to me, that's the real opportunity. And I don't think you can get that with a government managed program.
Yeah.
Not to mention no one has figured out what it costs and who's funding it.
Well, not to mention also, do you think of what happens to you at the BMV and you think I'm going to go stand in line or in some place that is not ideal or maybe not even a place of my choice. And my healthcare is going to be kind of like that. The sort of the precedent that the government has set with their programs has not made it easy. Even Social Security it's just now, getting online and things like that, which probably should have been 20 years ago, you think?
If you looked at the Canadian system and how they manage healthcare, you'll notice when you drive north of the border that they have magnificent road systems. That's because you have to drive really far to get healthcare. And I think that they haven't figured out the healthcare part, so they've actually paved their roads so you can just drive further. It's an issue, and again, it goes back to access, quality, and cost. You're going to give up something with that type of a system.
So you touched on it for a second, but urgent care seems to be the thing, one of the biggest factors of healthcare in that, now that, and I've done it myself with a bunch of kids. I mean, something goes wrong with a little strep throat or something, that's where I'm going. I'm not going to go to a hospital for that. And, one of the worst things to do is go to an emergency room. You need to go somewhere pretty quick that you can make an appointment at. Do you see that continuing? Is that going to expand?
I think what we're going to see is, moving beyond episodic care. I mean, going in urgent care and being more defined as on-demand healthcare in the community. They're already doing this. This is the inflection point for urgent care to really, really revolutionize the model. Because what do they have the opportunity to bring is that, natural transitions here based on COVID is more people that basically use an ER for primary care, seeing their doctor. That's just how they checked into healthcare, which is an exorbitant cost. That traffic pattern has been changed overnight because people are afraid of those facilities today. So you're going to see where they're going to be looking for access to a step ahead of that. They're not going to use the ERs for low level of care. So they're going to look for the most accessible points. So that's urgent care, redefined as on demand care, using technology, the things that we're promoting, taking a physical space and elevating it for virtual healthcare delivery, bringing specialists into the communities. Again, that can be, I don't want to go pre and post consult and talk to my orthopedic surgeon because I have to go to another medical facility. So the one-stop shopping aspect of it is the convenience, speaks to convenience. The one-stop healthcare speaks to genuinely engaging on a patient's terms, genuinely engaging personalized healthcare on a patient's terms. Number one, it's in your neighborhood. So I think that you look at the physical parts of it, they're in the dynamic spot to kind of redefine what they are and provide additional services in the community.
Yeah, and I think that the best part to me of what you mentioned is they're in your neighborhood.
Yep.
We have one in my neighborhood that you can set an appointment online, and it's very efficient. it's not the best space. I mean, the waiting areas and all that are not really that human, but you walk in, if your appointment's at 11 o'clock, you got an 11 o'clock appointment. And that's a big deal. And not only that, but it's like 6 blocks from my house. You know, so number one to me, I think, and I don't know, I'm sure, like I had a kid who played football that had a really bad finger. He got a really bad injury. And you know, if you played middle school or high school football, I looked at them and I said, well, you guys going to take him to the hospital? And they're like, no, you are. So we wound up in the emergency room, and it was a nightmare. We were basically there until like 6 o'clock in the morning, just trying to get a doctor to take a look at the thing.
You know, what's hurting urgent care, what's hurting community pharmacy is fragmentation. You know, the largest urgent care chain is 250 stores, so they can't engage, you know, large trucking populations where they're in a position to service that population probably better than anybody. You know, they compete with large organizations that provide that kind of healthcare service, you know, A to Z. So we're charged with organizing, you know, taking with one contract, 3,500 urgent cares into an industry contracting effort. So how do you put a face on an industry so it can service populations coast to coast? You can only do that with innovation. You can't get them to change practice. You can't get basically connecting them. So a patient, a truck driver that's looking for healthcare in motion going down the road, where does that happen? I need to know if I need COVID tested, what you're offering COVID sites that are providing testing. Can I get my prescription 10 miles ahead of me? Things that are like that you can't do by dealing with one region. You have to be able to do that nationally. So we're charged with working with organizations, those highly fragmented industries, community pharmacy and urgent care, organizing them. And that's really what we did previously around community pharmacy on just contracting. Now we're putting a whole patient engagement face on a lot of providers.
And so how do you do that?
Very complex. We put them on the same operating platform, the same patient engagement platform, I should say, relative to virtual health. So we have a system through Health and Motion Network that binds all of them on a common virtual health platform. So we can engage employers directly, ultimately engaging consumers directly with a healthcare platform.
And you just touched on it, but telehealth is part of that, right?
It's it's rudimentary infrastructure for virtual chat. Where it goes, Lee, is you take a pharmacist, a provider, and be able to share a medical record between them. You've taken a big step toward better healthcare. You know, that's how you would handle that prescription, you know, the 90-day supply of medication going out without a pharmacist involved. To have a local provider, again, local existing is really important to what we're talking about, and a local pharmacist collaborating for the value of a patient is transformational. I think, you know, those that are not involved in healthcare say, well, isn't that already happening? No, it's not. You know, so those kind of things where we're actually opening up communication, secure HIPAA compliant communication between large groups of providers, all for the benefit of the patient, is transformational.
And telehealth is like one of those things, a little like e-commerce, where it caught on really quick. The trend was pretty strong before COVID, and now it just exploded because, for obvious reasons, you don't want to leave the house, or you don't want to take your kids to a doctor's office or even an urgent care office, but you at least want to find out if they have strep throat.
Exactly. Exactly.
So, I mean, easy to use. Is there a way to sort of market that to make it easier than it is? Because even now, I don't really see a lot like, here's what you do. You go on here and you do this, and then you'll talk to a doctor and get this done right away. My wife knows how to navigate some of that stuff, but I don't really see sort of like a national advertising program or anything like that.
No, it's done. Again, a lot of things in healthcare are done in silos. You know, so that's what I'm trying to address. As an industry, you need to do it in a uniform fashion to really change and move the needle, so to speak, of who you are and how you can treat a patient wherever they exist. You know, WD is kind of coined it as healthcare anywhere, and we're part of that revolution of healthcare anywhere. So telehealth part, I'm not trying to poo-poo that. It's more complex because that initiates a patient engagement. The real healthcare is behind that. The real healthcare is when I go in to see my specialist, when I go in to see somebody physically or something. So it's the big tipping point, the big transition is that it's your providers using it, and it has to augment physical healthcare.
So big companies, do you compete with the behemoths for this? Because they're out there, that's for sure.
Yeah,
even though they don't advertise telehealth.
Yeah, and again, what I like about the behemoths is they're now normalizing. They're not saying it's the new normal. It's just normal to provide healthcare this way. It augments what I do and I provide it. So the behemoths have to get it started. But realistically, our job is to take the best that are not organized in that fashion. So we do compete with the large, organized, integrated healthcare solutions. We also compete with technology that jumps way in front of healthcare delivery. That further fragments, causes bad results, but just a disruption type technology. So, we look at managed platform, picking the best technologies, affiliating with it, and putting it into a patient's hands. We know we're an aggregator, so we look for existing technologies that are out in the marketplace that we can pull into to provide better healthcare.
So it's a slam on Americans that we're reactive, versus proactive. But there are also a big part of healthcare that has to do with sort of pre-care, like diet and that type of thing.
You see, in our world, it's all one thing. It's better healthcare.
Okay.
It's lifestyle, and again, not separating a person with diabetes, a consumer with diabetes, as having a disease. They need additional diet, they need additional support for nutrition, other things that are lifestyle enhancements, along with having access to a diabetic educator, an endocrinologist, so on and so forth. That's the access they need, is that specialist being there. But being able to bring healthcare to the consumer is absolutely the trend. And our job is to bring the best in healthcare to the consumer.
So no more soda, huh?
No, not at all.
A little less booze.
I think maybe a little bit of booze, but I think that's the whole isolation thing.
So sort of a grand arching scheme, like what's your greatest hope for the healthcare industry? Like what, and with that, I guess you could almost talk about like the future of healthcare as well. Like, because I'm sure when you think about what you really hope for, you're actually talking about the future, because it's certainly not right now.
I'm going to start by saying, my hope for the future is that I hope not. What my hope isn't is that it perpetuates the current system of haves and have-nots, because again, it puts the best in healthcare behind the lowest cost in healthcare and things that are not really long-term sustainable innovation. So, we're seeing that largely happening to a degree. Is there is a large haves and have-nots. We think that we can actually focus on what the patient needs, and personalizing it. So my greatest hope for healthcare is, again, that there's less in front of us from a middleman's perspective. How we become more transparent, how we become predictable to purchase. We offer a service that really becomes more directly engaging. Directly engaging our pharmacist through the system, instead of engaging through insurance company, because that limits access. And we see open access, freedom of choice doesn't mean you have to pay more for it. That doesn't mean you have to pay. You don't have to get into situations where you give up choice. With that, we think we can perpetuate healthcare. And my hope is, obviously, the business side of it. There isn't hope because it's not a strategy, because you have to actually look at what happens, what innovation is doing to healthcare, and really how it blends, and how providers can sustain utilizing technology. It's an example. You can't have a doctor that normally bills for a patient encounter at $100 because they have infrastructure, support, what it takes to run a primary care practice, and expect them to trade $40 telemedicine appointment. It isn't equal. So it's how we augment. My hope is that we're able to blend innovation into the best parts of healthcare.
Well, let's hope so. Let's hope here's to you, and a lot of success for that. I think a lot of people need it, and it's an issue for everybody for a reason, and one kind of long overdue, for some smart people like yourself to get involved and help us out.
We're trying every day.
It would have been around when my kids were smaller. My God. Hopefully they can take care of themselves. So are you set for some softball questions, kind of, or a little off topic? So this has been like so far kind of the weirdest century in American history. I think, but let's take the Civil War out of there. That was a weird decade altogether. Um, but what do you see going forward here? What do you see kind of in the 21st century? Not only healthcare, but in a lot of things. I think you feel like we've got off the rails a little bit here.
Well, let's come to grips with the consumers in charge. Consumers dictating healthcare now, and again, we have to meet them halfway with that. And so that halfway is that we have to understand there's a dynamic going on in access to healthcare. We can change that. So as I look at the 2021 and beyond, it's really normalizing that. Adapting to the new normal, redesigning our medical facilities to provide healthcare closer to home. Actually look at, in our model specifically, we've been compressed on going from employer engagement to direct to consumer. So everything, our demand for our solutions and innovation is so compressed. Three-year plans are now condensed into 18-month plans. So I think that's across the industry. I think you're seeing that because the demand for healthcare coming home is there. And our job as an organization is to obviously hold that into a managed platform, because it can't be further fragmentation, those type of things. So I see a lot of positive happening, a lot of positive things happening, expansion of scope of care in the neighborhood, being able to see patients on their terms much more readily.
Yeah, that's hopeful. How are you doing through all this? How are you doing, especially this year?
Wonderful. It's funny because you almost feel guilty in a sense that it's taken a pandemic to bring innovation to light, so to speak. But personally, I've had a really, really wonderful run here. I've had 3 grandchildren, had 3 children, and 3 grandchildren from March 23rd to April 10th. So during the height of the first pass of COVID, so everybody's healthy, babies are doing wonderful. So life is grand when you look at it. We're so blessed.
Well, that's the opposite of what I thought of. We had a child that was born just before 9/11, and 9/11 happened. I looked at that little baby and I'm said, sorry.
Exactly. Well, they're going to grow up in their baby pictures, going to wonder why everybody's wearing a mask. But that's part
or not.
Yeah, maybe.
I think what's interesting about the mask too is that I've been going to Asia for a long time, and in Japan, everybody's always wore a mask. And sure enough, their total numbers, they told them all put on masks. They're like, okay, I have 50 of them right over here, because anytime I get sick or there's somebody sick at work or whatever, you can walk down any of the streets in Tokyo and half the people have masks on normally. And sure enough, their numbers are super low. It's like a mask culture, stopping the spread of disease. And sure enough, they kind of came through with it.
Well, I think, truth be told, I think that everybody now has clearance to wear them on an airplane. They just didn't feel comfortable being out of step before. So I think I've wanted to wear a mask on an airplane a long time ago. So it's one of those things where we can do it now. It's fashionable.
Yeah, mask in an airplane. Yeah, I've always had that feeling. Because somebody's coughing right behind you, thinking, oh.
Yeah, we've seen too much of
everybody makes fun of me at work because we started at one point in time with 4 kids. One kid would get sick, everybody would get sick. And so by the time the 3rd one came around, we started quarantining them. So we would get masks and gloves, put them in their room with movies. They couldn't leave. And we would only go in there with masks and gloves. And man, that stopped everything. It stopped all of
it. So we're there. We have one in every color now, right?
Yeah. Okay, the last question now, what do you do for fun?
I thought this was it. I'm doing a lot of video meetings. No, I actually, I'm totally immersed in the business because of the demand on the business right now. So that is my fun. It's what gets me up in the morning, knowing that every day we're incomplete. We have to build on and become more complete. So that's what motivates me, and that's fun.
That's really great. Bully for you. I have to go cycling, or I start to lose my mind after a while, I think.
I want the dogs for release.
Yeah, well, especially early morning, I think that's one of the coolest things you can do.
Most definitely.
I see you guys out there.
We're out there.
Okay, thank you, Brian. You've been super gracious. Thank you very much, and thanks for making WD Partners a lot better. We really appreciate the information and the insights to a topic that's all near and dear to all of our hearts.
Happy to call you guys a partner.
Yeah, it never hurts.
Right.
So people be sure and listen to WD Cast as we produce good and more valuable and extremely interesting guests like Brian here. And also be sure to subscribe at the podcast, because it's at wdpartners.com. And if you go into the hashtag and it opens it up down at the bottom of the hashtag is a little podcast icon. Click on that and you can subscribe. And we also have, several, like I think 45 different podcasts from CEOs to entrepreneurs to writers and to people that take care of healthcare and are going to take care of us in the future. So thank you for listening. Stay safe. And remember, the first rule of leadership is it's always your fault. Thank you very much.